the CVOR, things can get intense very quickly. So we always talk about those people that really rise up when the need happens. So like the people that run into the fire versus running away from it. And that tends to be my staff. You know, they're also the ones that if something happens, they're all stepping up. Everyone works together as a team. And in fact, you know, when something changes in the patient's need, that's when you see our team working the best together.
The scrub techs and the nurses are the surgeons, a left hand, right hand, and sometimes even their brain. Because during those critical surgeries, they need a person who, before they can even think what instrument is necessary, they already have the instrument ready for them.
When I was a student, I got pushed into doing a vascular open AAA case, and it was the most fun, positive experience I ever had. I felt more at home doing that than anywhere else. It's a job that takes an entire team of people, so when you're all on the same page and all enjoying it together, it makes it better for the patient and better for the job.
Because you have anesthesia, you have the PAs who are in the operating room, the anesthesia techs. It's basically a team or a family.
So like if we're having to emergently put a patient on pump and TAVR, I usually have a backup person who already knows what I need and they're opening it onto the field so I can focus directly on what I'm doing and we can get that patient their best possible outcome.
One of the things that I think is unique about the CVOR is the relationship with the surgeons. Coming here and working with them over the last few years has been rewarding for me and the frontline staff. So working here at Rex, we have had some travelers, and some of our travelers have decided to work here permanently.
I like a sense of, not normalcy, but consistency in the people that I work with and what is to be expected. So if you like consistency, go for it.
I do see a huge benefit in becoming a permanent nurse, and the reason I chose to is because of the community that you develop.
So Rex is here really to support not only who we are today, but our future growth. We offer opportunities for succession planning within Rex, and we've seen many of our coworkers that have come in as a tech and have gone to nursing school, become nurses, and then become supervisors. So we really want to promote within our hospital to allow people and to empower them to grow.
A lot of people don't know that the cardiac or vascular OR would be the right fit for them until they actually spend some time there and get that glimpse of what that looks like.
We are obviously a 4-time magnet hospital for nursing excellence, and Leapfrog A. We've had straight A's since 2012, which was the inception of Leapfrog. And then we're also a CMS 5-star hospital.
And that's awarded to us from the Centers for Medicare and Medicaid, and that's based on quality. Out of those 3 awards, we are the top 2% in the country of hospitals that have won all 3 awards. And there are only 7 hospitals in the United States that have won all 3, and we're one of those 7 hospitals.
It's a challenge for sure, but I love a challenge. I think most people do, especially when you get into healthcare in general. You're not trying to go for an easy road job, but I love the work. Like even the mild amounts of stress that do happen, it's totally worth it.
What I love about being here is the support that we get from each other, but also the support that our hospital gives us. Such things as tuition reimbursement. People that want to go back to school, they give us money to do that. We have national certifications that we obtained to improve our practice, and Rex pays up front for that. Most hospitals don't.
Give it a shot, you never know. I mean, if you're just like thinking about it, you know, like come and interview, meet some of the people like me or another nurse or something like that. So if you have any questions or something like that, you would be hearing it from the people who were in it directly every day.